Did you know, according to 2020 WHO statistics, thyroid cancer is one of the top 10 cancer detected each year. Most thyroid cancers are found by accident, but in this video, I'm going to tell you the 5 common signs and symptoms of thyroid cancer you should be aware for a better chance of early detection. I'll also tell you who is at risk and what are the common types of thyroid cancer. Welcome to another episode of Doctor Says. Thyroid cancer, as the name suggests, occurs in the thyroid cells in a butterfly-shaped gland located at the base of your neck, just below your Adam's apple. Your thyroid produces hormones that regulates your heart rate, blood pressure, body temperature, and weight. Thyroid cancer typically doesn't cause any signs or symptoms in the early stages of the disease. As thyroid cancer grows, it may cause a lump or a nodule that can be felt through the skin on your neck. Some may not even notice it until a routine physical examination by your doctor, or it can be due to an incidental finding noted during a radiological procedure such as an ultrasound, CT scan, or MRI of the neck. A tip is to check and see if it moves up and down when you swallow, as most other lumps won't move.
Second, changes to your voice, including increasing harshness of voice.
The recurrent laryngeal nerve, which controls the muscles that open and close the vocal cords, lies right behind the thyroid. In rare cases, a nodule can extend beyond the thyroid, damaging the nerves and affecting your vocal cord,
causing harshness of voice.
Third, difficulty swallowing and pain in your neck and throat. Some thyroid cancer can grow quite aggressively, and this will stretch and compresses nearby structures like the esophagus and trachea, causing symptoms like pain, difficulty in breathing, and swallowing. Fourth, swollen lymph nodes in your neck. Our neck is full of lymph nodes. Some thyroid cancer can spread through the lymphatic channels, and this causes the lymph nodes in your neck to swell. And finally, chronic cough. A small percentage of people diagnosed with thyroid cancer will develop a cough that comes with no other symptoms. So, who is at risk of developing thyroid cancers? If you are a female, thyroid cancers occurs 3 times more often than in men. Second, exposure to high levels of radiation. Radiation therapy treatments to the head or neck, for instance, treatment of a childhood cancer, may increase the risk of thyroid cancers. And lastly, family history. There is a 10-fold increased risk of thyroid cancer if you have a family member diagnosed with it. The risk is even higher if it's a first-degree relatives. Genetic syndromes that increase the risk of thyroid cancer includes familial polyposis and multiple endocrine neoplasias. There are mainly 4 types of thyroid cancers, that is papillary, follicular, anaplastic, and medullary, which are all classified based on the types of cells found in the tumor. Papillary thyroid cancer would be the most common and gives the best prognosis, while anaplastic is usually very aggressive and carries the worst prognosis, with median survival time lasting just about 3 to 6 months. For diagnosis, all patients with thyroid nodules should be investigated, and this can be done with blood thyroid hormone levels, ultrasound of the neck, and radionuclide scan. And finally, if the thyroid nodules are more than 1 cm, it is recommended to undergo a procedure known as FNAC, or fine needle aspiration cytology, to rule out thyroid cancer. So there we have it, guys. Thank you for watching. Appreciate the little thumbs up, and don't forget to share and subscribe, and I'll see you next week.